Okay, I'm Dr. William O'Connor, and this is Miss June Lederman. She's a 92-year-old patient of mine who came to me roughly last year with a very profound anemia. This is her son, Jeff Lederman, and what we're going to do is document the findings that we have, because it has importance, I think, for future clinicians to know that a drug called imiquimod can be used internally to most probably cure a number of cancers of the gastrointestinal tract. Back in April 17th of 2018, Miss Lederman had a profound anemia with a hemoglobin of 5.1. That's very low. Her blood count indicated that she had been bleeding, and so we took her to the hospital, got a endoscopic examination done, and she was found to have an adenocarcinoma of the stomach. And that was discovered on 4/20/2018. And the stomach biopsy showed invasive, moderately to poorly differentiated adenocarcinoma. And she also had at the time a mild duodenitis, no ulcer identified, but they did a biopsy of her duodenum. So the presumption is that she was bleeding from this cancer, and it had given her a profound anemia, and they transfused her and brought her back. It was the election of the oncologist, in concert with the family, to spare her the rigors of surgery, which she most likely would not tolerate, because she was then 90 years old or 91 years old.
Just about 91.
And radiation and chemotherapy would also have such a devastating effect on her that it was considered not in her best interests to pursue that. And the patient did not want to go through chemotherapy either, because of the drastic decline in health that would engender. Long story short, I have had a lot of experience treating many skin cancers and other cancers, and had a successful treatment of an esophageal cancer, and knew that at least a third from the medical literature of gastric carcinomas and esophageal carcinomas had the DNA of the human papillomavirus in them. And so it was not an unreasonable proposition to give her the same cream that we use on skin lesions that are warts caused by human papilloma, which kill the wart as well as the cancers that come from the human papillomavirus. And I've done enough treatments on the skin and understood the capacity of this chemical called imiquimod to get the body's immune system to kill the cancer, that I convinced the patient and her son that it was not toxic from prior studies to ingest up to 2 packets per day of imiquimod, because prior studies had attempted to use it for cancers internal, such as lung cancers and whatnot, and they failed miserably. It had no effect, and so they abandoned that. But they found that you could take at least 2 packets a day and not get sick. And so I convinced the patient and her son that her ingestion of 1 packet a day was sufficient to get the contact of this chemical on the stomach tissue that actually was involved, because you have to actually touch this chemical to the cancer to be effective. And for approximately 2 months,
About 6 weeks.
yeah, about 6 weeks, we gave her a cracker with imiquimod on it, and she ingested that daily. What transpired was, as I expected, when you have an immune reaction of that significance, you get tired and it causes a flu-like syndrome. That flu-like syndrome was significant enough to deteriorate her mental status and her general well-being significantly, to the point that she had an advanced dementia that came on very rapidly, and she was not able to take care of herself and had to be transferred to a facility that could manage someone with that decline in mental status. On or around the time I elected to use imiquimod, I communicated with her oncologist and confirmed from her oncologist that she was a hospice candidate, because it was the oncologist's opinion, based on her prior experience with this adenocarcinoma in a patient her age, that she would not be alive in 6 months, that the cancer would have continued to erode her stomach, she would have continued to bleed, there would come a point where we could not stop the bleeding, and she would expire. Well, that's not what happened. We're now on a year anniversary of that treatment. She is alive and well. When we stopped the therapy after about 6 weeks, she recovered completely with her, and even got better with her dementia. Now that may be because of the neurologic regimen addition to that, but she improved to the degree that what you see now is a actually pretty healthy 91-year-old, and she as 92-year-old, and her anemia is completely resolved. I can bring out the laboratory tests to document that. Had she not had the therapy, most likely that anemia would have continued to progress, and she'd have eventually bled out. She isn't. Here she is. She's has a normal hematocrit and actually quite healthy. The point of doing this was that it really did happen, and we have her son, who is a attorney who understands the difference between fact and fiction. And in your opinion, is there any other way to explain her improvement and her resolution of that disease except by the treatment that was given? Do you think she lucked out of it, or do you think there was genuinely this chemical did that for her?
The oncologist didn't provide, who I had a very high amount of respect for, she did not provide a definite time frame for my mother. This was just about a year ago, but she said, you think in terms of months. I don't see any other explanation. It's very clear that the imiquimod had an effect. There was a period of time when she did have flu-like symptoms. I mean, she just wasn't interacting.
Right.
As her brother described it, she was pretty inert. Within a couple of days after coming off the imiquimod, she was back to normal. And so it clearly was doing something. I don't have any other explanation. Her hemoglobin's been tested several times since that episode where it was at 5, and after the imiquimod treatment, it's up in the 12 and 13 range, as I recall.
Right.
No, I don't have any other explanation for it. Why she's still alive, frankly.
Right. It was the expectation that she was going to expire, but she didn't, because she was treated with imiquimod. And let's see, here's most recent here's the most recent hemoglobin of August 2018, and it was 12.2.
Yeah, there's some more recent ones.
And there's more
actually.
recent ones
You'll
probably
find
too.
some in the
She's-
13 range.
She's sustained that recovery.
That hemoglobin count, plus or minus 1 or 1.5, has been the case for the last year,
Yeah.
since August of 2018.
So the point of this video is to document and ascertain that even a 91-year-old woman who is not a candidate for other cancer therapies can be rescued with imiquimod if it's ingested, because it actually can contact the tissue of the stomach and the cancer, and it acts as a hapten which signals to the immune system that it is a foreign protein, so that the immune system will attack it. And even a 91-year-old immune system is competent enough to destroy a cancer, and when no other therapies are believed to be effective or would have been effective.
And she specifically, I mean, she was asked at a point in time when, like now, she was without a doubt competent whether she wanted to undergo any therapies by the oncologist, and she said
Right.
no.
Right, and she, let's see, I asked you the other day where you went for Mother's Day, and you told me. Where did you go for Mother's Day?
Max's.
No, close,
Close.
close.
You knew it back then, but it was
Yeah.
Mel's Diner?
Mel's?
Mel's
That
Diner?
Oh, I thought that was Max.
No, it's Mel's. Close enough.
Oh,
Yeah,
well.
it was very nice. But it was on a Saturday.
Who went with you?
His wife,
Right.
me, and she was as enthusiastic as I was.
Who's your nurse at the nursing home? Who, where you're staying? Who's your
That's
favorite
very,
nurse?
very difficult, because she's actually changed again yesterday.
Oh.
Do you remember the name of the one you really liked the best, and she's not
So
serving
she
anymore?
was here with the doctor.
No, we're talking about the one at Pacifica. Diane, do you remember Diane?
She's not there anymore?
Yeah, no,
Oh,
it's been about a month, and then she's gone through 2 others since then, so I actually not sure I know the name of her current one. I know the last one.
well, I wasn't prepared to do a mental status
Yeah.
exam, but we've done mental status exams on her, and she's actually doing pretty good. She has a reasonably good memory.
Certainly the week after Mother's Day, and then I've
Yeah.
taken her there since. If you asked her where she went, she knew it was Mel's.
Yeah, I remember
Been, you know,
asking her, and she said Mel's Diner.
right.
And,
It's
and
been
she knew Denise had gone with you and all that. And that was
6 weeks ago.
very surprising, because initially when she was being treated, or while she was being treated, she was totally out of it. She couldn't remember anything. And so her brain came back. So is there anything you have in the way of thoughts? Did you think you were going to die because of the stomach problem? No, no,
I don't think she ever believed it.
didn't believe
We
it.
had those conversations.
Uh-huh.
It doesn't surprise me that she said no.
Well, I remember looking at you and asking you, "Do you want to die?" And you said no.
That's
And I
correct.
says, "Do you want me to give you the medicine?" And you said yes. And so you made that decision, and I think it was a good decision, and I think there's no other explanation for this improvement, because had she not been treated properly, she would have continued to bleed, the cancer would have continued to get bigger. You can't deny the biopsy. It was real. It's not like an opinion of mine. It's, here's a woman who a year ago had a lethal cancer, and now she's pretty much ambulatory and back to how she was before.
Which I never I never had a memory of renal cancer.
Uh-huh. Anything either of you want to add to this? Because I'm just documenting it for future reference so I can present that to someone and say, look, it's real, these people are real, here's a lawyer, he knows the difference between fact and fiction, and he's convinced that but for that therapy she would be dead.
What I'll add is, the pieces that are key to me is she had a 5-count hemoglobin, 5.1, and you called me as agitated as I've ever known you. I've known you for a couple of years now, basically saying take her to the emergency room, and they checked her in. She immediately was assigned a gastroenterologist who found quarter-sized lesions, ulcers in her stomach, and called me and said we need to do a biopsy. They did that. He called me 2 weeks later and said she had stomach cancer, and I'm referring her to an oncologist. The oncologist basically said it's a matter of months, and she had a transfusion at the time. She's had no further transfusions since April 2018, and she went on the imiclomod, and now her hemoglobin count is steady around 12.5 to 13, in that range. I don't see any other explanation for that.
Yeah.
Why all of a sudden?
And it's not worth going down with an endoscope to prove it, because that would be exposing her to the risk of endoscopy and the uncomfort or discomfort of it. And I'm satisfied. I don't need to go down there and prove that she doesn't have a stomach cancer
Well,
anymore. The hematocrit tells me that.
The bottom line is, if her hemoglobin count were to drop, and we were to do that and discover cancer, there's, other than more imiclomod, there's nothing we're going to do about it, that she won't do about it.
Right. Okay, well, thank you very much. I appreciate your consideration in letting me do this.
Thank you very much.